Hi everyone, welcome back to my YouTube channel. So in today's video we shall be discussing pathophysiology of septicemia. So in today's video we shall be discussing pathophysiology of septicemia. So under septicemia we shall be discussing the definition of septicemia, a causative agent of septicemia, risk factors, clinical features, diagnosis and tests, and pharmacological treatment of septicemia. So before we start, I would like to give brief overview of what septicemia means. So septicemia is an infection that occurs when bacteria enter the bloodstream and spread. It can lead to sepsis. So sepsis is the body's reaction to the infection, which can cause organ damage and even death. So septicemia is also known as blood poisoning. So septicemia is a blood poisoning is when an infection became chronic to the body, therefore causing organ dysfunction and resulting death. So sepsis is when the body's reaction to an infection, which can cause organ damage and even death. So septicemia is more common in people who are hospitalized or have other medical conditions, and it requires immediate medical attention and antibiotic treatment. So septicemia is a blood infection, or otherwise is a blood poisoning. So we shall be discussing now. Let us define the term septicemia. So septicemia is a blood infection. Septicemia is a blood infection. Is a blood infection due to various bacteria which may be associated with infection So septicemia is a blood infection due to various bacteria which may be associated with infection in specific sites. So septicemia is a type of infection that occur due to various bacteria which may be associated with infection in specific sites, such as the lungs, urinary tract and gastrointestinal tract. So septicemia is a blood infection that occurs due to various bacteria which may be associated with infection in specific sites in the body, such as the lungs, urinary tract and gastrointestinal tract. So a blood infection can occur as a result of various sites in the body, such as the lungs, that is maybe through pneumonia, common cold and respiratory infections. So in the urinary system, we have the kidney, the bladder, the urethra, and the urethra. So an infection can enter into the bloodstream through these ways. And in the gastrointestinal tract, for example, consuming of contaminated water, food, and other substances. So in such way, a bacteria or infection can enter into the bloodstream, which can cause septicemia, sepsis, and septic shock. So septicemia is a blood poisoning when an infection is became chronic to the body, therefore causing organ damage and even death without prompt medical treatment. So septicemia, it is a life-threatening. It is a life-threatening. Is a life-threatening. So septicemia, it is a life-threatening condition. It is a life-threatening condition. It is a life-threatening condition because it can progress. Because it can progress. It can progress into multi-organ dysfunction. Into multi-organ dysfunction. Into multi-organ dysfunction and septic shock. Septic shock. So septicemia, it is a life-threatening condition. Life-threatening means it is very dangerous and contagious. So life-threatening means it is very dangerous condition which can progress into multi-organ dysfunction and septic shock, because when septicemia affects the organs, therefore the normal functioning of the organ will be disrupted, because a physiological condition of the organs will be damaged, therefore causing or resulting septic shock and death. So septicemia is a very dangerous disease. So let me explain. Septicemia is a blood infection due to various bacteria which may be associated with infection in specific sites in the body, such as the lungs, urinary tract, and gastrointestinal tract. So we can get infection through, for example, if we have an open wound, maybe due to severe burns or traumatic injury, or by consuming contaminated food and water. We can also get infection through by having a common cold, which can be chronic, changing into pneumonia or bronchitis. So through these ways our lung will be infected. So an infection can travel further into the body, therefore disrupting the normal functioning of the organism and can result in septic shock or death. So septicemia is an infection that occurs when bacteria enter into the bloodstream and spread it. Okay, let us see now the etiology or the causative agent of septicemia. Okay, let us see now the causative organism of septicemia: blood infection or blood poisoning. Okay, the first one we have is Staphylococcus. Staphylococcus aureus. Staphylococcus aureus. So the first causative organism of septicemia is Staphylococcus aureus. The second one we have is Streptococcus pneumoniae. So the other causative organism of septicemia is Streptococcus pneumoniae. Okay, the last one we have is Escherichia bacteria. Escherichia coli bacteria. So the third causative organism of septicemia is Escherichia coli bacteria. Okay, these are the most causative organism of septicemia blood infection. Okay, so these are the most causative organism of septicemia. Okay, let us now see the risk factors of septicemia. Okay, let us now see the risk factors of septicemia. So what are risk factors? Risk factors are any factors or conditions that accelerate the occurrence of a disease or a condition. So let us now discuss the risk factors of septicemia. The first one we have is extremely of age. For example, we have extremes of age. For example, we have adult and children. So the first risk factor of septicemia is extremes of age. For example, we have adult and children. So this is because adult people, their immune system, that is the thymus gland. So when young children mostly their thymus size is larger when in childhood. So as the person grows, the size of the thymus gland, which located in the chest, that boosted the immune system of the body, became shrinking its size. Therefore, adults are likely to get the infection because of old age. So and children, they are likely to get the infection because they are so prone of having maybe or near to contaminated food, water and other substances that may accelerate the occurrence of the condition. Okay, the second one we have is diabetes. So diabetes is a chronic high blood sugar level disease which can weaken the immune system. So once the immune system became weak, therefore infection can easily attack the body and it can affect the normal functioning of the organs and therefore causing an organ damage and death. So diabetic is also risky factors of septicemia. So diabetes means high blood sugar level, uncontrollable of high blood sugar level. Okay, we also have cancer patients. We also have cancer. So cancer is also an infectious disease which weakens the immune system because it can destroy the cells of the immune system. Therefore, infection is likely to affect the body and cause organ dysfunction. So cancer is also a risky factor of septicemia. Okay, we also have community acquired pneumonia. We have community acquired pneumonia. So we also have community acquired pneumonia. community acquired pneumonia. So community acquired pneumonia, this is a chronic condition which occurs epidemically in a certain population, so it can cause lung infection, so therefore causing septicemia to occur or enter into the bloodstream. Okay, we also have urinary tract infection. Urinary tract infection. So urinary tract infection is an infection which affects the urinary system, that is the kidney, the bladder, the urethra, the ureter. So it can cause infection in the urinary system, therefore it can result in septicemia because the infection becomes chronic and it can spread into other parts of the body, therefore disrupting or altering the normal functioning of the organs, or they can cause septic shock or death. So urinary tract infection is also risky factors of septicemia. Okay, we also have skin ulcers. Or open wounds. So skin ulcers or open wounds, they can cause infection because a bacteria, a fungi, or a virus, they can enter into the bloodstream, therefore resulting septicemia. Okay, now the last one we have is weak immune system. So one is if the body's immunity became very weak, therefore infection is likely to affect the body and cause organ dysfunction. So septicemia is likely to occur due to weak immune system. So the body is not resistant to disease, therefore its immunity is very weak. So an infection can easily enter into the bloodstream and affect it, or it can damage the normal functioning of the organs. Okay, now let us discuss the clinical features or the signs and symptoms of septicemia. Let us now discuss the clinical features of septicemia. So clinical features is the same as sign and symptoms of septicemia: blood infection or blood poisoning. So the first sign we have is high fever. So the first symptoms of septicemia is high fever that is greater than 38 degrees Celsius. That 8 degree Celsius. That is 38 degree Celsius. So the first sign of septicemia blood infection is high fever, that is a temperature reading that is greater than 38 degrees Celsius. So this is the first sign of the first symptoms of or the clinical feature of septicemia. The second one we have is weakness. So the patient feels extremely of tiredness, that is weakness. Okay, we also have hypotension. Hypotension. So hypotension, that is a drop of blood pressure, that is a reading less than 90 to 60 mmHg. mmHg. So the patient will feel hypotension, that is a drop of blood pressure reading, a reading that is less than 90, that's the systolic, which is supposed to be 120, and 60, that is the diastolic, which is supposed to be 80. So there will be a decrease or a drop of blood pressure. That one is known as hypotension. So that is the another clinical feature of septicemia. Okay, we also have sweating. So the patient will feel extremely of sweating due to high body temperature. So sweating is another clinical feature of septicemia. Okay, we also have the other symptoms of septicemia is anemia. That is a decrease of hemoglobin level. So that is a decrease of hemoglobin level that is less than 6.5 gram stroke deciliter. So there will be anemia. The patient may experience anemia that is less than 6.5 gram stroke deciliter. So anemia is the reduction of hemoglobin level in the blood. So the patient will experience anemia. That is the clinical feature of septicemia. Okay, we also have pneumonia. So the patient may experience respiratory infection like pneumonia. The patient may experience pneumonia. So pneumonia is a respiratory tract infection which affects primarily the lungs or the air sac that holds the mechanism of breathing. So the patient may experience pneumonia. We also have toxic shock. So the patient may experience toxic shock or septic shock, that is blood poisoning. So the patient may undergo a coma or shock due to the weak immune system of the body and organ dysfunction. So these are the clinical features of septicemia. So now we shall be discussing the differential diagnosis of septicemia. Let us now discuss the differential diagnosis of septicemia. So differential diagnosis means there are a number of conditions which may be similar to the sign and symptoms of septicemia. Therefore, we have to exclude first the other diseases. So if we exclude them, then we can apparently say that this sign and symptoms are the clinical features of septicemia. So differential diagnosis of septicemia include, we have typhoid fever. So first we have to exclude typhoid fever. We have to confirm if there is typhoid infection. Okay, we also have meningitis. So meningitis means inflammation of the meninges, the membrane that cover the brain. So if there is an infection of that membrane, so there will be inflammation of the meninges. So we have to exclude if there is the possible sign and symptoms of meningitis. Okay, the other differential diagnosis of septicemia is infective endocarditis, infective endocarditis. So infective endocarditis means inflammation of the membrane that cover the heart. So if there is an infection of the membrane of the heart, so we have to exclude that, because these symptoms may be similar to the sign and symptoms of endocarditis. So we have to confirm and exclude if there is infective endocarditis. Okay, we must also confirm if there is encephalitis. So encephalitis means inflammation or an infection of the brain. So we have to exclude if there is the possible symptoms of brain damage or brain infection. So we have to exclude this disease. So these are the possible differential diagnosis of septicemia. Now let us discuss the investigations or laboratory diagnosis of septicemia. Let us now see the possible investigations or laboratory diagnosis of septicemia. Okay, now let us discuss. So firstly, what we do is we have to look for primary source of infection. We have to look for primary source of infection, looking for primary source of infection. So your doctor or your laboratory technician will first look for the primary source of infection, the source of the causative organism of septicemia. Okay, we also have blood. So we have blood testing. So your doctor will do a draw of blood, which will be testing under in the laboratory. So in the laboratory, let us see the laboratory finding of laboratory findings. So in the laboratory findings, your doctor will observe the following. The first sign is hypothermia. We have hypothermia. That is a temperature reading. Less than 35.6 degrees Celsius. So a temperature of less than 35.6 degrees Celsius is the laboratory finding of septicemia. We also have hyperthermia. So that is high fever. So hyperthermia means high fever. Hyperthermia is a term of high fever, that is a temperature reading greater than 38 degrees Celsius. A temperature reading that is greater than 38 degrees Celsius. Okay, your doctor will also observe tachycardia. Tachycardia. So tachycardia means abnormal heart rate that is greater than 90 beats per minute. 90 beats per minute. So The patient will experience tachycardia, that is abnormal heart rate that is greater than 90 beats per minute. Okay. The patient will also experience a hypotension, that is a drop of blood pressure less than 90, stroke 60 mmHg. So there will be a hypotension, that is a drop of blood pressure that is less than 90, that's the systolic, stroke 60, and that is the diastolic. So there will be a drop of blood pressure. Okay. There will be also tachypnea. Which means, so there will be also tachypnea, which means respiratory rate that is greater than 20 breaths per minute. So the patient will experience tachypnea, that is abnormal respiratory rate that is greater than 20 breaths per minute. 20 breaths per minute. Okay. In the WPC, so WPC, that is the white blood cell count. So your doctor will find the following. So your doctor will find a WPC count. So WPC count, for example, we have the leukocytes. We have the leukocyte that is greater than 12,000 or greater than 4,000 UL. 4,000 UL. So in the WPC count, so as we know, we have the WPC, and that's the white blood cell counts. We have the leukocytes, we have the monocyte, we have the lymphocyte, eosinophil, and neutrobasophil. So in the WPC count, in the blood testing, your doctor or your laboratory technician will find the following: a WPC count, for example, the leukocytes is greater than 12,000 or 4,000. Okay. The other possible finding is positive blood culture. A positive blood culture. So in the laboratory diagnosis, your doctor will possibly find positive blood culture. Okay. Your doctor will also find electrolyte imbalance. Electrolyte imbalance. So in the laboratory diagnosis, your doctor will also confirm and find that there is electrolyte imbalance, that is magnesium, calcium, potassium, phosphorus, sodium. Okay. Okay, your doctor will also find hypoxemia. So Hypoxemia means decreased we have hypoxemia. So in the laboratory diagnosis, your doctor will find hypoxemia, that is decreased oxygen level in the blood. For example, that is less than SpO2 let me write, that is SpO2 less than 75. Okay, so because if the patient is in septic condition, the level of oxygen in the blood, the percentage of oxygen in the blood will go down, that is the SpO2. So these are the possible laboratory finding of septicemia. So now we shall be discussing the possible treatment of septicemia. Let us now see the pharmacological treatment. Let us now see the pharmacological treatment of septicemia. So the first one we have is IV fluid. Giving IV fluids. For example, we have EG, we have normal saline. EG, we have normal saline. EG, we have normal saline. So normal saline is the preferable IV infusion which is used to manage septicemia. So we give IV fluids, for example, normal saline. Controlling temperature, controlling temperature. For example, we have EG, we have IV BCM, or IM diclofenac. IV BCM or IM diclofenac. So the two way of controlling body temperature is by administering IV BCM or IM diclofenac. Okay, we have nutritional support. So we have nutritional support, for example, if possible NGT, so that is nasogastric tube feeding. We have the NGT, nasogastric tube feeding, if necessary. So your doctor will do nutritional support for the patient, that is NGT, nasogastric tube feeding, if necessary. Okay, monitoring of vital signs. So your doctor or your healthcare provider will always monitor your vital signs like change in temperature, in the blood pressure, pulse rate, oxygen saturation, and maybe if possible RBS, that is random blood sugar, and urine output, and urine output. So your doctor or your healthcare provider will always monitor your vital signs and urine output. Okay, administering antibiotics. Administering antibiotics. So your doctor will administer for you IV antibiotics. Administering IV antibiotics. So the following antibiotics is used to treat severe blood infection. So if you want to treat a blood infection for a patient who is in septic shock or septicemia, the following IV antibiotics are the most preferable drugs that are used to treat blood infection, that is severe blood infection or blood poisoning. So the first one we have is IV gentamicin. So how will you administer IV gentamicin, especially adults? So the formula is 7 mg per kg, 7 mg per kg Q24H. So the first antibiotic that is used to treat severe blood infection or septicemia is administering IV gentamicin. The dose of adult is 7 mg per kg, that is Q24H, means after every 24 hours. So for example, and in the day we have 24 hours, so in that 24 hours we divide by the number of hours we have been given. For example, we have been given Q24H, that means after every 24 hours. So 24 divided by 24, that one gives us roughly 1. So that means you are supposed to take one is daily. You are supposed to take the drug one is daily. So your doctor will give you the injection one is daily. Okay, for the dose of children is 3.5 mg per kg. 3.5 mg per kg, that is Q24H. So the dose of children is 3.5 mg per kg 24 hoursly, that means one is daily. Okay, the second antibiotic that is used to treat severe blood infection is IV coloxacillin. That is 2 gram daily. So that is adult dose. So if you want to treat for coloxacillin, so the dose of adult dose coloxacillin is 2 gram daily. So you can administer maybe in 4 divided doses. So the patient should not take exceeding 2 gram daily. So the second antibiotic we used to treat septicemia is IV coloxacillin, that is the adult dose 2 gram daily. Okay, what about for children? So the dose of children is, for example, we have child. So we have child. So the dose of children is 100. Sorry, the dose of children is 100 to 200 mg per kg. Per kg Q 6H. That means after every 6 hours. So the dose of IV coloxacillin for children is 100 to 200 mg per kg. That is given after every 6 hours. So in the day we have 24 clock system. So in that 24 we divide 24 divided by 6. So that one gives us 4. Therefore the child should take the drug 4 times daily. That is QID. So that one is equal 4 times daily. 4 times daily. 4 times daily. So that is the dose of for children. Okay, we also have IV ceftriaxone. We also have IV ceftriaxone. We also have IV ceftriaxone. IV ceftriaxone. IV ceftriaxone 2 gram daily. That is the adult dose. So you can either give 1 gram in the morning and 1 gram in the day, a maximum of 4 gram. So you cannot exceed 4 gram daily for the dose of IV ceftriaxone, especially for adults. Okay, now let us see the dose for children. So the dose of, for example, the dose of children is, the dose of children for ceftriaxone is 50 mg per kg. 50 mg per kg. So you divide 50 mg and times the body weight of the child, so that you can administer the drug. So the dose of ceftriaxone for children is 50 mg per kg. That is for BD. So BD, which is equal, or let us say, for example, Q to LFH. So Q to LFH means after every 12 hours. So in the day we have 24 hours. So we divide 24 divided by 12. That one gives us 4. That one gives us 2. Therefore, which is equal 2 times daily, which is equal 2 times daily, which is equal 2 times daily. So this is the dose of ceftriaxone for children. So you divide 50 mg per kg. So that's how you are going to get. Okay, we also have another injection called benzyl penicillin. We also have benzyl penicillin. We have benzyl penicillin. That is 500,000 IU per kg. So we also have IV benzyl penicillin. We have IV benzyl penicillin. That is 500,000 IU. That is international unit per kg. That is the adult dose. So which is given after every, which is given Q, which is given, that is per kg, which is given after every 4 to 6 hours. So you can give this injection after every 4 to 6 hours. So this is called IV benzyl penicillin, which is 500,000 IU, that is international unit per kg, which is given after every 4 to 6 hours. Okay, what about the dose of children? Okay, the dose of children is 200,000 up to 400,000 IU per kg, which is given after every 4 to 6 hours. Which is given per kg, which is given after every 4 to 6 hours. So this is how we are going to give for the dose of children. So let me write here. So that is for children. This is for children. So the dose of children is 200,000 up to 400,000 IU international unit per kg, that is given after every 4 to 6 hours. So this is called benzyl penicillin. Okay, we also have the last injection for severe infection or septicemia is IV chloramphenicol, IV chloramphenicol, which is 750 mg, 750 mg, which is given after every 6 hours. So the other drug, antibiotic injection, which is used for severe blood infection is IV chloramphenicol, that is 750 mg, which is given after every 6 hours. So we divide 24 divided by 6, that one gives us 4, so which means the same as 4 times daily. So these are the best antibiotic agents which is used to treat septicemia, that is blood infection or blood poisoning. So now let us see the method of preventing septicemia. Okay, let us now see the method of preventing septicemia, that is blood infection. So getting all recommended vaccine, getting all recommended vaccines, So one of the best way of preventing septicemia is getting all the recommended vaccines available. Okay, regularly hand washing, regularly hand washing. So you have to practice hand washing for you to stay away for contracting septicemia, that is blood poisoning or blood infection. So maybe proper cooking of foods, proper cooking and handling of foods, So foods must be well cooked and must be well handled. For example, food, maybe the food practitioners, so they should be themselves be clean and they should handle the food properly with appropriate manner by practicing hygiene safety measures. So practicing hand hygiene, after visiting toilet. So you have to practice hand hygiene by washing your hands after coming out from the toilet. So you have to practice proper hand washing after visiting the toilet, or maybe washing your hands before eating foods. So you have to wash your hands properly before you handle or before you eat anything. So these are the best way of practicing septicemia. The other way is proper avoiding contact, avoiding touching surgical instruments. For example, surgical and sharp instruments, used instruments. So you have to avoid touching surgical and sharp used instruments. So this can cause, or this can bring for you, very severe infection. So this is how we are going to prevent septicemia, that is blood poisoning. So now these are the pathophysiology of septicemia. So we have talked about the definition and the explanation of septicemia. We have talked about the etiology, the causative agent of septicemia. Okay, we have also talked about the risk factors, any conditions that accelerate the possibility or the occurrence of the disease. We have talked about the clinical features, the signs and symptoms of septicemia. So we have also discussed about the differential diagnosis of septicemia. We have also discussed about the laboratory investigations of, or laboratory findings of septicemia. We have also discussed about the possible pharmacological treatment of septicemia. Last, we have discussed the prevention of septicemia. So these are the pathophysiology or the pathogenesis of septicemia. So thanks for your watching and have a nice day.